are three major factors that you need to take a look at in our view. First is setting the right KPIs and dealing with the issue of physicians focusing on providing care as opposed to anything else. So the recent anti-corruption campaign, I believe, is very, very necessary for something like this. But it has to be done in the right way. The good news is it has been solved before. If you look at Taiwan 30 years ago, they had the exact same problem, okay, the red envelope problem, and they solved it, right? They upgraded the payment of the physicians. They started this fund where if you get a red envelope, you donate it to that particular fund, and then it's evenly distributed amongst doctors, etc. So culturally, it can be solved, but it has to be done on a very massive scale. Then the other factor is the fact that you have 85% of care being provided by public hospitals. The KPIs of public hospitals are nowhere near the type of KPIs you need to stimulate or encourage innovation. It's income, right, cost control, etc. Nothing of the type of KPIs that you need, like, how many times a patient comes back to the hospital for the same type of ailment, number of hospital stays, etc. Right? The second factor is commercial insurance. They have to step up. It continues to be a situation where there's a significant strain on social insurance. And commercial insurance have to start getting their act together in that particular area. So those are some of the factors that need to come into play in order for us to start talking about innovation or AI in this particular space, is you have to build a delivery. The last point I want to talk about is, as you know, the US basically built a hodgepodge of free market capitalism type of healthcare insurance. It does not work, right? The government has to play a very important role in terms of setting the rules of the game and avoiding the mistakes that were done in the US. The US is the only country where that's not the case. So we're not talking about just China. We're talking about UK, Germany, etc. If you're able to set the right rules and set them globally or universally in place, okay, that is another very important starting point in order to see to it that the dollars that you're spending on healthcare are well worth it.